Hello and welcome to another Piper's Pearl. Today's pearl we're going to be looking at the Fluorescein eye stain. Now, Fluorescein itself is extensively used as a diagnostic tool, especially in the field of ophthalmology. Now, Fluorescein is a fluorescent compound that's yellowish green and fluorescent. The compound can be used to demarcate the vascular areas under observation, especially observation with cobalt blue light. And this aids in distinguishing it from the adjacent areas that aren't demarcated or aren't broken. Now, it is often applied topically in the form of drops or strips itself. So what the Fluorescein is mostly used for, so the first two tests is things that we can do to help us in our lines of tests. Once we move on to the other tests, they're a little bit more specific and they take equipment that we don't often use. So the first test is testing the lacrimals themselves in the form of dry eyes. So the tear film breakup time test is one that we will go through, and it's also used classically to detect cornea epithelial defects. So the Fluorescein itself will stain the epithelial defects, and you'll actually get negative staining on the areas that are defected, as opposed to just natural absorption or tear film covering for the areas that aren't. The other test is the slider test. It's used with a much stronger version of Fluorescein, and it's used to detect any penetration of the eye, and it's done with a slit lamp as well. Then we have the applanation test, which really tests the intraocular pressure itself. So moving on, we'll start by looking up this tear breakup time test, or the TBUT. Now, the TBUT is defined as the time taken for the first dry spot to appear on the cornea after a complete blink. The TBUT measurement itself is an easy and fast method used to assess the stability of something known as the tear film. It is a standard diagnostic procedure for anything to do with dry eyes. Now, the volume of tears in the eyes depend on two factors. First of all, we have the drainage through the lacrimal passages itself and evaporation. Now, factors like decreased tear production, increased evaporation rate, or even tear film instability due to hyperosmolarity, inflammation, or ocular surface damage can cause dryness in the eyes. And note, I didn't mention increased screen time because it's not actually true. Now, conventionally, when you do the TBUT measurement, it's often used with a slit lamp under cobalt blue light, but you can do it with Fluorescein and using the cobalt blue of an app on a phone, or you can also get an ophthalmoscope itself. Now, the procedure is pretty simple. You first off put Fluorescein into the lower fornix of the eye, so in the lower part of the eye, and the eye examined is done under low magnification. So you don't have to zoom in, you want to see the whole eye itself, and you must have a cobalt blue filter. Once the Fluorescein is in, the patient is asked to blink once and then keep the eyes open for at least 10 seconds. Now, the Fluorescein color, the tear film will appear to come across as green. Now, any black spots that you indicate will be an indication of an area of dry eyes, and this will occur within a few seconds after blinking. Now, the TBUT is a time interval between the last blink and the appearance of this dry spot itself. Now, if a patient blinks before the 10 seconds is up, then the test has to be restarted. It's best to take two measurements. Basically, if any black spots occur in less than 10 seconds, then you have an indication of dry eyes, and that could be your diagnosis. This patient has dry eyes, and you can give them medication to help lubricate and protect their eyes. The second test that we'll look at is when you look for corneal abrasions. Now, Fluorescein can be a very useful tool at looking for these abrasions. It also is used for ulcers. You have herpes infections as well, and really bad cases of dry eyes can also cause these abrasive ulcers to form. So it's done pretty much the same way, where you put fluorescein in the eye, and any areas of corneal defect will, if you imagine it down on a cellular level, you're going to have a cavity in which the cornea is no longer uniform. So you no longer have that surface tension across the eye because there's some sort of demarcation within the cornea. This will cause the fluorescein to pool within that area, which makes it very easy to see, especially under cobalt blue filter, as you can see on the right side of the picture. Now, looking at fluorescein itself, it comes in drops and strips itself. Now, drops are very, very convenient, but in our environment, they're difficult to maintain. They're quite fragile, and they often need to be kept in a fridge or a cool environment itself, which means if you're in the northern parts of the country, it's almost impossible to do. So you can get strips, which I prefer because they're very lightweight and useful. Now, the idea of the strips can seem a little bit daunting because the recommended use is you dip a little bit of normal saline on the end of it, and then you physically place it into the lower part of the eye, so in between the eyelid and the eye itself, for the fluorescein to absorb into the tear film. Okay, so not the best and quite uncomfortable for the patient as well. So another option you can do is you can place the strip itself in a syringe and then draw up 1 to 2 mils of fluid. Normal saline for injection is fine, and then wait for that fluid to absorb the fluorescein from the strip itself. So therefore you'll have a solution like the drops that you've created yourself that doesn't need to be refrigerated. Now, it almost goes without saying, but I'll say it anyway, when you're injecting it into the eye, remove the needle first. If you want a more concentrated drip, then you can use a 20 gauge cannula on the end of your syringe, but sometimes just allowing it to drop from the end of a small syringe, 3 to 5 mil syringe is fine, can be enough to cover the eye with fluorescein itself. Okay, that covers the pearl on fluorescein eye stain. I hope you got something out of it. A couple of things you can look into and add to your arsenal of diagnostic skills. And until next time, take care.